Hello, everyone. So, today's topic is blepharitis. As the name suggests, blephar means leads. Itis is inflammation. So, here you can say that blepharitis is an inflammation of the lid margin. So, when you talk about the lid margin, here you can see the lid margin where there are opening of the meibomian glands and there are root of the eyelashes in both upper and lower eyelid. And the glands of Zeiss is also situated at the root of the eyelash. And if you say, what are the types of blepharitis? In case of blepharitis, because when you talk about the lid margin, there is anterior border and posterior border. So anterior border, when it is inflamed, that is known as anterior blepharitis. When posterior, it is known as a posterior blepharitis. When you talk about posterior blepharitis, this is known as a meibomitis, where the opening of the meibomian glands are there, and that is the inflammation of the meibomian glands. The discharge will be yellow, white, all that. That's about already. I think last time we have already spoken regarding meibomitis. So today we are going to talk about anterior blepharitis. In anterior blepharitis, there are types. There are two types. Known as one is allergic and another is a bacterial or ulcerative. When you talk about allergic, it's a seborrheic also. The patient may complain of dandruff in the hair, and usually there is a itching at the lid margin. Here, if you see the three types of things are seen here, normal eyelid margin. Here we can see is the anterior blepharitis. That means at the root of the eyelashes there will be crust formation, and here is a posterior where you can see the opening of the meibomian glands. There will be discharge. And what symptoms? In case of blepharitis, the symptoms may be there is a itching of the lid margin. There may be some discharge at the lid margin. The crust formation is there. And especially in that lid margin, there is a lots of dryness is there. So these are the types of inflammation at the lid margin. And usually this is a allergic. So in case of what is the difference? In ulcerative, whatever crust is there, if you remove the crust, there will be ulcer. Ulcer formation is ulcerative blepharitis. Usually, this is a bacterial infection. So, in both the cases, here in case of ulcerative, there will be lots of pain and ulceration is there. Redness over the skin is there. There's pain, tenderness. So, all this thing you will see in case of ulcerative. And if you don't treat the blepharitis, exactly what happens? Naturally, the lid margin is much associated very near to the conjunctiva and the cornea. So there may be conjunctivitis. If cornea is involved, there may be photophobia, blurring of the vision, because the tear film is also having a problem, and because of that, there's a dryness. And the eyelashes which are there, they may go inwards and leads to foreign body sensation, irritation. All this happens, especially in ulcerative blepharitis. And if you don't treat that, if it remains chronic, there will be a conjunctivitis. Chalazion formation may be there. That is, meibomitis can lead to chalazion. There may be corneal ulcer. Sty may be there. Lots of sty is there. So ultimately, hygiene is very important in case of blepharitis. In allopathy line of treatment, of course, in any pathy, very important is cleanliness. The cleaning of the lid margin is very important, especially in the morning or whenever there is a discharge or crust formation. With little warm water, you can just clean. And in case of blepharitis, especially seborrheic or allergic, the Johnson and Johnson baby shampoo, which is there, you can apply at the in the cotton and then just clean it. So that you can do. And especially if it is ulcerative, you have to apply local antibiotic ointment at the rate margin. These are the things you have to, especially in allopathy. Otherwise, along with cleanliness, you can always start with many other pathies, like homeopathy and along with lead matching, of course, all other things, treatment of the dandruff is also equally important.
So, hello and namaste, and I hope that all of you are doing well. And we are talking about an important topic today about blepharitis and especially about the homeopathic strategies in it. We have discussed about this in the past that the idea of homeopathy is a very in-depth case-taking process where we try to understand in the case-taking process deeper patterns about the person, about the chief complaint, about their inner emotional patterns, physical patterns, transgenerational patterns. And we really study this in different areas of one's life. And after studying all of this thorough, in-depth case taking, we try to choose a homeopathic remedy which is tailor-made for that individual person. Because the main concept of homeopathy is holism and individualism. Blepharitis as a differential diagnosis for my homeopathic colleagues. There are some very important remedies for blepharitis. And no other remedy that I can think of is the number one remedy for blepharitis is bacilline. Bacillinum is the number one remedy for blepharitis. Okay. Especially with a past history of ringworm, with a tubercular miasm in the pattern, with the feeling of everything is very fast, everything is too hectic. I want to do things fast enough. I feel trapped. I need to do things fast. Macelinum becomes a very important kind of remedy for blepharitis, especially also with the dry eruptions around the eyelids. I did do so many other homeopathic remedies, right? All the typical remedies, including sulfur, mesarium, graphitis, and so on. But the remedy that always comes to one's mind, especially if indicated, is bacillus. But finally, we have to find the remedy for the person, and that is the entire idea of homeopathy. So, make the best benefit of homeopathy. Meet a really good homeopath in your area and take his or her consultation. We have an integrated homeopathic clinic here with so many doctors associated. If you wish to contact us, whether in person or online, this is our email ID, gaurang@gmail.com and the phone number. So we look forward to see you. Thank you and namaste. It's prepared from tubercular bacillus. Tubercular discharge. It's a very